Eunice Mann's son describes her as someone who took pride in her family. There's all these pictures to prove it. She was a wife and a mom, taught school for over 30 years, and enjoyed quilting and planting flowers.
You know, when she couldn't do it anymore, to get the flowers planted in the pots, and we had flowers all over, and we probably will again. But that's what was really important to her. And then the garden. She used to be a good gardener.
She died in December. While it was hard to say goodbye, Tim says she was able to live her life to the fullest, even in her final months, thanks to home hospice care.
She always had a bad valve in her heart. She was doing okay, and she just slowly, her heart cut down. She was low on oxygen. We had her on oxygen. The doctor said that you'd probably going to have to be on hospice, you know. And of course, everybody thought hospice is when they're going to die, you know, which it is. But we thought, the way they took care of her, it's a good thing for living, you know. I mean, she had such a great life at the end, and she just appreciated so much what they all did for her.
Hospice teams are there to support when a cure is no longer an option. Eunice started home hospice in May of last year. Staff came out to her home about 4 or 5 times a week, including Bethany Eichelberger, who is the Avera at-home nursing supervisor at Avera St. Anthony's in O'Neill.
It didn't take very long at all for her to say how appreciative she was of the program, because we were able to supply the equipment that she needed here to keep her here.
When a hospice patient needs a different bed, if they need a new wheelchair or more oxygen, then the team gets that to them as quickly as possible. We're able to provide medications that help provide comfort and relieve shortness of breath, whether it's pain or anxiety.
We have somebody on call 24/7. So holidays, nights, weekends, always there's somebody on call. Like Tim said, if he had issues or wanted to change something, he'd just give me a call, and it was very easy.
Really great, you know, and it took a lot of pressure off of me because they would come out here and would stay here for a couple hours, you know, help her with dishes and just talking to her, somebody to be here.
Not only did the hospice team support Eunice, but also Tim and the rest of his family.
I enjoyed them coming too. I, you know, sat here and talked to the nurses, got to know them, and they supported me too. I knew she was going, and that's why we had her out here helping me out, you know. And she got to stay at home and do the things she wanted to do until she couldn't do anymore.
This option gave Eunice a chance to maintain a quality of life right here at home, leaving memories for her family to cherish forever.
She stayed right here in her house, and I think that's what most people want to do. Of course, it's always hard, but my mom lived to be 95, so she had a good life.